Sure. Okay. So joint mobilizations, sure, it's to help with mobilizing the joints, right?
Simple.
Increasing range of motion, decreasing pain, increasing joint nutrition, stretching the joint capsules, and it's to help with specific conditions. So we have your in joint mobilizations, we have oscillations and distraction.
Okay.
And we also have what you call tractioning, right? You guys probably know what tractioning is. There's long axis and there's short axis. Someone go on the table here.
I'm still full.
Okay. So this,
Supine, sir?
yes, fine. This you guys probably know, right? Maybe you've done it. Maybe one of the students has done it to you, right? So I got permission from her already. Okay, I'm gonna do all these joint mobilizations. I don't have to keep on asking. The second
Yeah,
you're
ask
supposed to
once
ask
they're
for
done.
everything, informed consent for everything.
Yes.
So, has anyone done this to you before?
Yes.
Yeah.
Okay, or have you done this on someone before?
Yes.
Right? So it's either doing it this way. We can bring it out here. We can go this way.
Except that one.
Or as far as you, if as the joint allows you, you can go this way. I can modify this. I can do it differently. The way I do it, I like doing this. I'm a lazy guy. What do you call that? What do you call that? What is that? You're like, yeah, I've done it. Yeah, someone's done it. I go, what is that? What is that technique? What joint mobilization technique is that?
It's for the.
So, we have your limb. I'm at the distal part, right? This is called a long axis traction because I'm at the long axis. Short axis, I'd be grabbing here to do the distraction of that joint here at the hip, the acetabulo-femoral joint, AC joint, right? So I'm gonna traction from here. I'm gonna do what's called sustained distraction.
Oh, okay.
This is a sustained distraction. I'm gonna hold this for 10 to 15 seconds. I've created space within that joint, right? But what level of distraction am I doing? Is it grade 1, grade 2, grade 3? You don't know. Because I control that, okay? I, as a therapist, will control that grade on my client. Most therapists, they just go like this. They don't even know what grade they're using. They just do this because, hey, I learned this in school. I just pull this. I just do a tractioning.
How do you know the grade 1,
Okay.
2, and 3?
So that's going to be up to you again, right?
Yeah.
So grade 1, maybe it's like really close here. Grade 2, grade 3, grade 4. That's up to you to do that, right? But we need to assess the joints first before doing any joint mobilization. So for me, let's say I'm gonna go here, right? I'm just gonna check if there's any, okay, like if there's any traction, like any distraction that I can do, or how much space or mobility is within that capsule. I'm starting to notice her
Shaking.
spasm. Yeah, there's like spasm going on here.
Yeah.
So
I can see
I
the up and down of the.
I noticed some things already. There's weakness of muscles. There's muscle guarding on some structures. I can even check from here. You're like seeing things that you don't usually do, or some like you don't see other people doing, right? And so this is assessment of the capsule at the hip. Right, so I'm feeling what's going on there. Right. Okay. So for me, I'm just trying to assess before doing anything. Like, what do I need to do? Okay. So there's a lot of restrictions going on. So for me, was there any pain or any discomfort when I was doing that?
No.
No. So do I need to do grade 1 for pain reduction?
No, because there's no pain.
There's no pain.
Yeah.
Grade 2 is more on joint nutrition and maybe increasing range of motion. So maybe I can do that. I can start at grade 2.
Yeah.
So for me, let's say I can go from long axis. I can do short axis by going here at the knee. So let's do short axis for me at the hip here. So for me, if I go all the way, let's just say this is 100%, or let's say this is grade 4. I go halfway, this is grade 2. So from here, I can stay there and do a grade 2 distraction or sustained distractions. I'll hold this for 10 seconds. All right, so after 10 seconds, I bring it back. And then you repeat this 2 to 3 times. All right, so this is going to help with increasing range of motion, bringing in nutrition, and then repeat that 1 or 2 more times.
The grade 2, sorry.
Yeah, so that's my grade 2. If I need to stretch the capsule or to increase the range of motion a little bit more, I can go to that grade 4. So how's that feeling there? Let me know if there's any pain or discomfort as I'm doing this, okay?
No.
So just breathe properly, right? Try not to hold your breath. So things aren't awkward and silent. Like if you hate silence, you can create conversation if you want, right? Oh yeah, just let me know how this feeling. You check in with your client from time to time, just to keep it kind of interesting, right? Just keep breathing. How's that feeling so far?
It's okay.
Don't breathe.
Good. Just remember,
okay.
don't hold your breath, right?
Yeah.
Don't be like, oh yeah, so how are you doing today?
It's already
Yeah.
powerful.
I mean, if you've got like a report where your clients, like you've seen them like 20 times already, sure you can make conversations of like different things, right? So that's your distraction, right? So if we were to go oscillations, it's a little bit different,
Yeah.
So with this one, maybe I'll do long axis,
No.
right? So there's no pain, maybe I'll see how far I can go. So that's her level 4, or grade 4, grade 3, grade 2. So I can do oscillations, right?
Oh, that's oscillation.
So small amplitude oscillations, right? So it's tiny movements.
Okay.
If I do like medium or big amplitude, it's a little bit more movement, right?
Still movement.
Nice.
Then you can do this for 10, 15 seconds and then relax and then go again, right? But make sure when you're at the ankle, sometimes you end up tractioning the ankle and then afterwards your client is like, oh, my ankle hurts because they go here, right? So if you are going at the ankle, make sure you're above the joint.
Okay.
That's why sometimes too, this is great here because I can go here and go this way. But now this takes a little bit more strength
Yeah.
for you as a therapist. But for me, this is easy because I use a table, body weight, right?
It's nice.
So I was doing grade 2, grade 3. You couldn't tell if that was grade 2, grade 3, right?
Yeah.
But I could tell. So now when I reassess again, maybe I get more range, right? Maybe the client doesn't feel any pain anymore, right? There's not as much restrictions, but I can go from this. I can even go at an angle, right? Because the joint, right, it can move around, so I can create space in different angles if needed. So now with, let's say, dislocations, where's your bad shoulder? Let's go to her bad shoulder.
Yeah.
Okay, so we can do joint mobilization on someone who has a shoulder issue, especially dislocation, frozen shoulder, right? I mean, what you want to do is assess it first though, right? So the head of the humerus, right? I can push down and see how much movement it's getting, right? If there's a lot of restrictions. How's that feel?
There's a pain
Where?
here.
Like where I'm pressing here? Okay, so
Below.
below here.
Yeah.
So there's tendons also here, right? So you have to be careful sometimes too, especially the bicep tendon. The supratendon also, because it's like, you'll feel this like snapping tendon here. right? So be careful you're not digging on there. But me, I can basically just check if there's limited range of motion, right? So if there's limited range of motion, that signifies, sure, level 2 or level 3 would be great for this grade. And then if there's pain, then we can go grade 1 first, right? So I can do an anterior, so this is the anterior to posterior glide, okay? Anterior to posterior glide joint mobilizations. So what we can do is we can go from here and then just basically do some small amplitude joint mobilizations, right?
Grade 1.
Yeah, so grade 1. The bigger amplitude, which creates more of a grade 2, right? And then grade 3 all the way to the table, right? Notice that the movement isn't as fast, right? I'm going a little bit more, but it's a slow movement, right? So there's different ways of doing these. So if she can, I can do this, bending her elbow, which still creates this anterior to posterior glide. And there's a lot more like theory behind this with arthrokinematics and osteokinematics, because we have to understand that concave convex situation. So relax your arms, right? So from here I can do this, right? So grade 1, right? Grade 2, grade 3, right? See it? There's small amplitude, big amplitude, right? How's that feel when I'm doing the movement?
No pain.
Right?
No pain.
So there shouldn't be any pain when you're doing this. If there's pain, maybe you need to readjust or you need to do something else. Okay? So we can do the traction here if you wanted to, or we can do tractioning up here. Okay? It's short axis traction. So if I were to do long axis, sometimes I support at the wrist and I support at the elbow. Make sure your client's relaxed though, because right now she's very active. Right? She's kind of like holding this. She's like, yeah, she's bending it, right? So, so you can do kind of like an inferior glide in a way. So you're going inferiorly, like a distraction at an inferior angle. Right? You can do sustained distraction, or you can do that small amplitude or big amplitude. Right? You can go from an angle here also, and you can go from here. Right?
And sir, this is for supine, sir. Best to do this in supine, sir.
Yeah, for this one, you can still do it prone if you wanted to, right? You can still do it, but the best would be supine,
Okay.
right? And then, let's say for, especially with shoulder dislocations, we can do a posterior anterior glide also, right? Sometimes we have to support, depending how you want to do things. You can have them hold on your arm, right? So hold on my arms as I do this to relax your shoulders. So just hold on to there as a support. And then, right, I can do posterior to anterior glide. So from the back now, going this way. So let's say in relation to dislocation, if it was dislocated this way, I have to go anterior to posterior, okay? Which you will learn in second year, the condition of dislocation. Whoever teaches you, they may or may not show you joint mobilization. So if it's a dislocation, which is a very common, is anterior, what you're gonna do is this, right? That anterior to posterior glide. But if it was dislocated backwards, you do posterior to anterior glide to help create that space. So for me, maybe this, right? So in a way, yeah, sure, that kind of like that drawer test. So you'll see, right? You're moving that joint capsule this way, right? How's that feel for you?
Good. No pain.
So sometimes the client's like, that feels weird, but I kind of like it,
Yeah.
right? There's even superior to inferior glide also, right? There's different ways of doing it. Some people, they can just do like this way. some people use their body, right? It just depends how comfortable you are to doing that, right? So here, what I can do also is, so your client needs to be relaxed. She's very active, right? So, right? So it's basically, right? So for me, you're doing a mobilization going down this way. So you're basically doing that there, right? So, and there's even inferior to superior, right? So that's how that's going to be, especially for the shoulder. For the wrist, that's easy for you guys to do because you can just do a distraction and the oscillation on there. Like let's say with this one, right? Some people
For
don't do this.
carpal tunnel syndrome, sir, right?
Yeah, if you
Or
wanted
you
to
can
do
do-
joint mobilizations,
Okay.
yes, you can mobilize the wrist. You can do a gliding thing, so distraction and then do oscillations going radially to ulnar. So
Ah,
maybe superior, or let's just say, because this is anterior,
Yes.
this is lateral though,
Yeah, that.
right? So lateral to medial in a way. So I'm going to distract, creating that space, and then I'm going to oscillate to one side. If we need to go to the other side, same thing, right? But it might be a little bit harder when you try to
Yeah.
rotate this way, so maybe when they're prone,
Yeah.
right? But here I can do joint moves here to sustain traction, or I can do that oscillation if I wanted to, okay? Or I can even go here and then go anterior to posterior. It's just, do you know your arthrokinematics or the directions of where
Of
you
the
can move
joints.
your joints,
Yeah,
right?
you should.
So try practicing that on each other and see how that feels, if you
Okay.
can do it, right? So maybe two people on one person. Let's see if you guys can do that. Maybe one doing the hip, one doing the shoulder, right? It's very different learning it in person than just doing theory.
Yung sa, ano na,
Shoulder the hips.
the long axis, sir?
Mm-hmm.
I didn't saw how. So when you, was it here?
Yeah, you
About
try
the
to
ankle?
go at the top of the joint, right? But if it's not possible, you can support the bottom of the heel, right? And then support the top of the ankle. Like, this is weird. How do we do this? Right? So, right, maybe on that side, yeah, you can use whichever dominant side sometimes is what you're using under. And then the top is just supporting. So like let's say here, I'm kind of here. And then I pull here. It's like the two of us there. Yeah. Because there's two of us, so there's two people like with the body weight. And it's just like whang. Right?
Okay, sorry.
And then you're gonna use your body too, right? You're gonna use your body weight, use your legs instead of just your upper body strength, right? Because like here I can squat a little bit and then just lean down. So there's two of us pulling again. That's why she's moving.
Sorry.
It's okay. Feels good.
I know.
Alright, so you're doing long axis traction, but basically you're doing in a way sustained distraction there, right? Because sustained means you're holding it, right?
And then here, sir, where did you touch it, sir?
So you're basically bending the knee first,
Oh, okay.
right? And then you can either use your elbow here, and then basically what you're doing is you're using your body to kind of do this. Like you're using this, that's what you're doing,
Oscillation.
right? To do that oscillation there if you want it. Or to just hold it and do like a sustain.
Baby.
Like that, sir?
Yeah. And then you think about your grades, right? In what you want to do. Is it grade 1, 2, 3, or 4? If you're gonna do small amplitude oscillations, or are you gonna do big amplitude oscillations? Right.
But that's different.
Yeah, it makes a difference too sometimes. Like either with the client or let's say with the therapist, what's comfortable for you, right?
But with this, sir, movement, because it's flexor, right?
Mm.
So only this way, sir? Or you can also.
You can do that way too if the joint allows you to, right? Because if the client, if you bring it into abduction and then their
But no
AC
pain.
joint is kind of like catching, right? And then the clients may be in pain, then obviously you're not gonna be able to do it more than abducted state, right?
Gusto ko to.
Yeah, I like that. It's good for you.
Yeah, a lot of people like the distraction, the sustained one, because it's kind of like stretching the joint, right? It's stretching the joint, it's stretching the muscles, the tendons, and it's creating relief for some people.
Sir, how many seconds, sir, the oscillation?
10 to 15 seconds, right? 5 to 10 seconds. It's really up to you, right? Some of us get very lazy. You're just like 1, 2, 3, 1, 2, 3, or you create a count. You can 1, 2, 3, all the way to 10 if you want, right?
Oh, tayo mo si Sam.
Because I've had or I've seen one. I don't know what they are, but they've done like joint mobilization where they did oscillation for like I think 2 minutes, right? I don't know what the reasoning was for that. Yeah. Like sometimes it depends like the parts of the body you're trying to like mobilize. It may be harder to do on some joints compared to other joints. Because I can oscillate your spine, I can do joint mobs on your spine. She's like, yeah,
Yes.
show me. Let me feel.
Yes,
Show
sir.
it to us, sir.
Do we have sanitizers here? Are there any?
I
wipes?
had one, sir.
Are there any wipes anywhere so that you can wipe like one of those face
I can
tables?
grab, sir.
Yeah, see if there's any there.
Dito sa shoulder.
Shoulder one.
Oh, it looks so nice outside.
Is it sunny?
Yeah, it is so sunny. It's supposed to be -3 this morning.
It's been so cold for like the past few days.
Yeah.
Even this morning.
Yeah, it's -3, -3 also the beach. Maybe it's cold at the park, right? It's sunny. It's nice.
I have another massage today.
Andiyan si Ronnie.
Say, what time is your massage?
3:30.
Say, nandyan?
Yung kakilala na.
Ito si Sortod?
Yes. May mga student siya na.
Magpuha sila.
So who taught you guys PNF again or MTP2?
NTP 1 and 2.
About 3.
Sir Antonio.
Sir Antonio.
We learned more from him, sir.
It is what it is. That's what I'm
Yeah,
saying,
it depends
right?
on the teacher. Okay.
Sir, where did he resign?
Who?
He didn't know, sir. He didn't know.
Oh, from here? Oh, did he? A lot of things. There's always issues in schools, right? It could be with the people working here. Maybe he was offered a job with a different place,
Yeah.
right? Maybe there were scheduling issues, right? There's a lot of reasons. 'Cause it's kind of like, let's say with me at East West, right? I was underpaid, mistreated,
Oh.
so I'm like, why am I gonna stay with you guys, right?
Yeah.
I felt bad for my students because when I left, like, all the instructors they got afterwards were, I don't know, right? But at the same time, I was kind of happy I left because seeing how someone I taught for a month, right? I mean, I didn't start teaching them before, so it wasn't my job to basically teach them their practical, but seeing how they are afterwards, I'm like, yeah, good thing I left, I guess. I didn't want to be associated with that. That's the thing to being an instructor, because when you graduate and you have students who, especially if it's like those schools where you teach them for a whole year, or like you're their main instructor the whole time, you're basically everything you know
Just from the instructor.
is from that one instructor,
Yeah.
right? So if you have students at the very end who graduate and then the way they practice isn't what you taught them,
Yeah.
and they're just like doing something that's under even mediocre. It's very under. And they're like, who taught you? Oh, yeah, Sir Ellie. I'm like, no,
No, you're kidding.
no. Right?
You're kidding.
Yeah.
You.
I didn't.
So, joint mobilization for the spine. Wow, I'm
Yeah,
teaching us
yes.
a bunch of things, right? So
Yes.
these are also these are PNF techniques, joint mobilizations, which is used for your treatments. It's also used for therapeutic exercise, right? Because kinesiologists and physios do this. You can add this in your treatments,
Yeah.
whether they're draped, because you just have them hold on to that beautiful draping you have, right? So they're holding and you're mobilizing, right? Same with the shoulders, right? When you're doing
Yes.
they're having them nice and tucked in there. You
Yeah.
made for female, maybe you can have them put their hand on top
Yes.
there, so that when you're mobilizing, you don't do any exposure.
Yes.
It's nice.
Okay, so who's gonna go on the table for okay?
No.
Cause my back is.
Okay.
Okay.
So joint mobilizations of the spine, right? You have to be able to palpate. Your palpation skills have to be pretty good. So your palpation skills are pretty bad. Okay. The reason I say that because you guys said musculoskeletal.
The same teacher.
Who's your teacher for musculo?
Sir Todd.
Okay. Right, so you're supposed to be able to palpate from C1, right? I'm just gonna bring this down a little bit because your neck is extended. Okay. So usually you want to be able to make sure too, because your neck's still. How's that feeling in your neck? Is it
Is it
uncomfortable? Is there
It's
any?
okay now.
It's okay. Because sometimes you can see that they're they're extended this way. So by bringing it lower, it stretches that spine. It makes it a little bit more comfortable. Now you can work a little bit. Alright, so if you can feel from C1 all the way to L5, right? But you should be able to. So for me, I'll palpate one by one. C7 is that bone that's sticking out
Yes.
usually, for especially someone like this.
Yeah.
Right? You can see their C7 popping out. And then you can go from there as a landmark if you want, right? So if you feel the spinous process, so you know that like do not directly work on the spine with your elbow or your bone,
Yes.
right? True, you shouldn't be going bang,
Yes.
right? Like turn on to like
Or the crown.
whatever, or my knuckle onto your spine. It shouldn't be like dig, 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 dig. But we can treat the spine. We can go on the spine. So if I'm on the spinous process, right, I'll go on one. I can do a kind of posterior to anterior joint mobilization on here, right? She might be like, oh, that's kind of painful, right? But I can mobilize this going down towards the table, right on top of the spine itself, right? To help increase joint mobility there because the spine is very stuck in a lot of people.
So does it feel, Marbet?
A little bit painful.
Yeah, because some people are going to be very tender in the spinous process because it's an attachment point of multifidi rotatoris, right?
Yeah.
So what does that mean? It's not my job to teach you. It's either one side is pulling on the other side, creating rotational there, or one side is pulling this way, or both are pulling, right? So now it's like, they're fighting each other, right? So this can help, right? But if it's too tender for some clients, then you can mobilize it going down towards the table. Now, anterior glide, you can do, right? So for that posterior to anterior glide, you can go down directly on the spine, right? On the spinous process. I mean, you're not like using 100% of your strength, right? Maybe 10%, and you're just mobilizing it in a way. So for me, I can do, is that painful? Yeah, so she's got issues with some of her. So this is what they also call the spinous process check,
Yeah.
right? If there's a pain, if there is discomfort, then there are issues around that structure, right? So if I were to do a lateral glide, so I can go, so where's that skeleton? The
Skeleton,
skeleton
yeah.
here,
Yeah.
right? So we have Mr. Skeleton here, right? So this is where you're going on top of for that mobilization that way, right? So I can do lateral glide, mobilization going that way. if it needs to be. Let's say if my palpation is great that I can feel that this is rotated slightly here, or if I go here and there's like pain and I check both sides and maybe one side's more hypertonic than the other side, then I may mobilize. So if this is tight here, I'll mobilize to that side. So I can place my thumb here and push that way. So I can do a glide that way, right? So for her, right, let's just say we're spinous process there. I can go to the side of the spinous process, right? And basically, you get, it might be painful for her, right? Because I feel that her back is like super restricted. So I can do slow glide. I can do oscillations if I wanted to, right? There's people who have never had this done on them before. They can be like, oh my god, that is amazing, right? Parang ano lang pa effect minsan, right? Even though you're just like, man, what else am I gonna do? Okay, I'll do this. And they're like, wow, no one's ever done that before.
Yeah.
Right? And you're like, yeah, because no one usually does this. You add those stuff, make them feel like you're so smart. You know? Right? So you can go on every spine or vertebra and mobilize it if you wanted to. Right? When you are mobilizing, you get, yeah, you're gonna need to do some mobilization on your spine.
Is the massage therapy can do this, sir? Or who can do it?
You can do it. This is joint mobilization.
It can be
Yeah.
part of our treatment.
It is part of your scope. You're not doing adjustments, right? You're not adjusting a person's back. Kind of like if I were to do this, I'll just lean on her, right? And if I hear a crack, you can't tell me that I did an adjustment. I was just compressing. I got away with an adjustment, but that was not an adjustment. Yeah, I just compressed her tissue.
Yeah.
So which I did feel like one adjustment there, but wow. Yeah, so you guys can feel her her spine. You can use your fingertips if you wanted to, and then mobilize that way, right? But she is pretty sensitive on some of her spinous process. But try mobilizing her spine. This is actually gonna benefit her.
Sir, this way, sir, right? Because this is the spinous process.
Yeah, you're at the side of the vertebra,
Yeah.
right?
And then this way, sir?
Yeah, you're going laterally,
Lateral.
right? Like you're still at the side so that you're mobilizing that vertebra itself. It's like once you become really good in palpation and joint mobilization, it becomes this easy technique to add on your treatment.
Yeah.
Like when you guys end up treating back, or when your clients come in like, where can you work on my back? All you do is like elbow, 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 knuckles. It's like you're doing muscle stripping, muscle kneading, effleurage, elbow. That's all you're doing most of the times, right? Where's your myofascial release? Where's your joint mobilization techniques, right? Where's your origin insertion? Because even with,
Sir,
yeah.
this one, sir, the spinous, you just did the anterior like this, pushing down.
So posterior to anterior. So you're bringing it. So let's say if my thumb was here, I'm going that way. I'm going that direction. So I'm just slowly mobilizing it that way. You're not using too much pressure because let's say with her, it's painful there, right? That spinous process is painful for her, right? There's
And
other
then-
issues going on.
On the side, sir, you just.
Yeah. So the side here, I'm going kind of in a way. I'm pushing
Oh.
that way. So I'm mobilizing because this rotates. There's
Yes.
movement there, right? Some people, if we really palpate some people, let's say the spinous process may be rotated this way and this is like rotated that way, right? It's still in a straight line, but the spinous process is kind of rotated a little bit this way. Yeah.
I can tell.
Right?
Yeah.
But that's where your palpations kick in. But if you don't have the practice in palpation, then you don't have that where you can be like, I feel that these structures have issues. But
It's
doing
not-
some, like even this, like this alone, you can do at home,
Yeah.
right?
And it's not straight. It's kind of crooked.
Because like sometimes we
Yeah, that one.
like sometimes we even interpret some spinal issues where I've oh my goodness, I've heard some massage therapists go, yeah, they have scoliosis, because I could feel their spine is tilted to one side. I'm like, wait, are you sure it's scoliosis, or is it just their spine is their vertebra is rotated to one side, right? Where they get an X-ray, they go to the doctor, they get an X-ray, they're like, no, you don't have scoliosis,
Yeah.
right? They're like, we just see some rotation. But when you say something that like that, they're like, you have scoliosis. They go,
They go
that's
crazy.
scary. Yeah.
It is.
How are you feeling, sis?
I'm good. No pain there.
It's
Just
funny because like
rocking.
even doing this joint mobilization,
This
some
one,
people they
no.
love it because it feels like you're massaging them too, because you are directly on top of your erectors there, even your multifidus and rotatories, right? And did you know no one really works on the multifidus and rotatories
Not everyone.
because no one really knows them,
Yeah.
right?
Oh.
They don't practice
Oh,
it.
here, no.
Yeah, ito. This one.
I haven't been here.
Because when I have clients who have like back issues, I work on their multifidus and rotatories as much as possible, and I mobilize their thoracic spine because everyone has issues here. But do we think about that? No. We just what we do is we go, right? Dig, 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 dig. Work, 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 work. Right? Cha, cha, cha. F rush, F rush. Right? You go there, there. Right? And then that's it. And then that's it.
And the spine.
Right? Because what people do is basically effleurage,
Yeah.
effleurage, 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 right? And then you need, if you do that circular movement, you do choo choo choo.
But the main issue is in the spine.
Wee, right?
Yeah.
And then you know, it's like, okay, we'll go here. All right,
Done.
legs. Then go.
Oh yeah, those are just like that.
GTO. Done. Right?
That's
Is
true.
that
Yeah.
familiar to you guys?
Yes.
Right?
It's true. GTO. Good thing you added GTO.
Huh? Very familiar, huh?
Yeah.
Either you've done it or someone's done it to you. Right?
We did it, sir.
We can even mobilize the sacrum too.
Oh yeah,
actually.
yes, please, sir.
Right?
Okay.
So you have to know where your palpations are though, right? Like you have to be good on your palpations, right? So
Yes.
PSIS, right? So lumbar, once we get to 3, around 3 or 4, that's where your sacrum kind of starts. Okay? So, yeah, right there.
Yeah.
4, 5, right?
Between 4 and 5, sir. The
The PSIS,
PSI.
right? And then right underneath is, that's a sacrum right there.
Yeah.
It's part of your sacrum. And that's this notation, counter notation thing for sacral. Right?
That's my issue.
There's so much things that, I don't know, right? So I can go right on top of the sacrum if I want and mobilize.
How does it feel? Good.
Right? So with this one though, be careful with male clients because private parts of male,
Oh, okay.
right?
Yeah.
You're going on top here,
Yeah.
private parts, right?
Yeah, okay.
So there's no intention, there's nothing going
Yeah.
on at all, but it's a natural reaction, right?
Yeah.
So when you
Okay.
are mobilizing that, just be careful, right? But because this is a specific thing where you're treating for specific issues, maybe lower back pain, hip pain, let's say lateral, like hip issues, but most of the time it's lower back hip issues, right? So I can mobilize it posterior to anteriorly, right?
But sir, if you tell them about your issue, they never even focusing on it.
Yeah, that's a
That's the thing, right? That's the
Yeah.
problem, right? Because we can mobilize
Even
the
both
the
now.
ilium too, right? We can mobilize this, guys.
Yeah,
Okay,
but they ask you.
because you can have them side lying, even from side lying, supine. So go supine, right?
Okay.
So supine, right? PSIS, ASIS, AIIS here, right? So we can do mobilizations, right? So maybe just one side you can mobilize. So you find that, right? ASIS I can mobilize, just like, ew, that tickles, right? That tickles, or there's like pain, that's weird, right? You can mobilize that way, right? You can mobilize that way. There's even, you can mobilize both, but you have to be very careful. This is a gapping test, what they call a gapping test, where there may be pain if I go like that,
In
like,
both
"Ugh,"
sides.
right? Because you can mobilize there, right? It's funny, we can even mobilize this guy,
Those pubic symptoms.
the pubic symphysis.
While
But
doing
that's
this,
gonna
sir.
be very specific,
Yeah.
and very informed consent,
Yes.
and there has to be a
Yes.
rapport with the client.
Yeah.
You can't just go first visit. You've got issues on your pubic symphysis. Hey, guess what? When you tell me that, what's going on? Is this place like what's
Safe.
going on? Right? You have a male
Correct.
therapist. Hey, I'm gonna work on your pubic symphysis. You're not working there, right? But pubic symphysis is actually pretty high on the actual body, where it's actually right here.
Yeah.
Right? Private parts are lower, but
Yeah.
very close,
Yeah.
right? But how about you go to a place, there's like a, hey, I'm
No.
gonna work on your pubic symphysis, right?
No.
No, why are you
No.
working there, right?
That's not what I asked you.
Correct.
Right? Right?
Not that one.
Right,
not
and then
my
they go,
condition.
this is part of your hips. Right? They're gonna be like, yes, that's part of your hips, right? But like, why are you going there, right? What's the need, right? There's no reason, right? What else?
I am limping. Why are you working?
Right, so you can mobilize every joint as long as you know the movements of those joints, right? All your fingers, you can mobilize all your fingers. Our clients who have rheumatoid arthritis, this is great because you can do like circular movements on there, or you do oscillations. So you're like, that feels so good. Like those old people. Dear, that's so good. Those older people, right? But they'll love you for it, right? So mobilizing that, rib mobilization you can also do. I like doing it when they're prone rather than supine. Right?
How do you do the rib, sir?
Go prone.
Sorry.
There's a test where they do rib springing from like the
Oh,
back
yes,
and
yeah.
the front, but if, like I said, with your palpation skills, you have to be good, right? Because if you palpate, you can feel the ribs, right? So if you're on the ribs, let's say for me, okay, there's one there, I can mobilize it, right? But is there an indication why you're mobilizing the ribs, right? Is there a reason why you're mobilizing it? Are the ribs subluxed? Was there a previous dislocation, right? Because the ribs are pretty fragile. No.
Yeah. So if the client has asthma or any, like if she's experiencing cough or yeah,
Which technique do you think they tell you to do?
yeah, like that. But her ribs, sir, is very tender. Yeah, I mean like you can't really
You can work on the intercostals, right? So if you know where your intercostals are, right? So from the back here, like from the spine, you're already able to work on there. If you can palpate within there, then yeah, you can work specifically on there, right? All the way from the side here, right? Being careful you're not on breast tissue,
Yeah.
right? Because I can go all the way here. She's like, ow, that hurts. Is that painful? A little bit. I can work on her intercostals and her serratus at the same time, right? But she's like, ew, that's painful. Because no one really works on these muscles.
Yes.
So they're not
Yes.
used to touch,
Yeah.
right? How does it feel there?
Sometimes
So,
that's
and then some people it tickles, but sometimes ticklish or that feeling of being tickled, it's a defense mechanism for the body too, right? How muscle spasm is a defense mechanism. Some people they get very ticklish, and that's a mechanism of the body also.
Okay.
Right?
So that's only the how do you mobilize the muscle in the program.
Yeah, or you can do like a specific movements, but this is more like when they're closed already, right? From the supine, you can mobilize from the first rib, second rib, and third rib here, and basically mobilize that way. You can even mobilize the clavicle, right? So go face up,
Sorry, supine. Dahan lang.
right? Because we can mobilize the scapula, obviously, because we can grab this, go side, go up, go down. You can push down, mobilizing that way. So with the clavicle, right? If you know where it is, external attachment points, clavicle here, right, going to the acromion, right? So this, I can mobilize. It might be tender for some people,
Yeah.
right, because we've got scalenes going underneath, we got subclavius here. If you were like right on
Yeah.
the subclavius, that's gonna be painful. I can go here and I can pull down this way, but it might be tender for her because, like I said, scalenes go under again, right? You okay? Right, but has anyone ever done
No.
something like this one?
No.
So for her, she's like, ow, 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 because her pecs are quite tight,
Yeah.
right? So, yeah, she's like, tight pecs, let's stretch your pecs.
Oh, sure. That's how you. Okay.
This is how you would stretch and she's like, oh, that's painful, right? And then I can have her reach above here too. Wee. Wee. Oh, that's tender. Yeah, she's got very tender pecs. I'm not even going that hard too, right? And then I can go in her subscap here and be like, oh, she's gonna hate me, right? I'm like, ow. Alright, subscap here. Ooh, stretch this way. Alright. But yeah, it's like, I mean, there's like a lot of things that you can do basically, but yeah, that's basically your joint mobilization and the joint. You can mobilize the patella,
Okay.
right? Which is easy. So look at where that patella and that skeleton is, right? So it's like a floating bone in a way, right? Yeah, that guy.
Yeah.
So that guy you can mobilize. A lot of people have very tight patella, but hers is hypermobile. So we've got a lot of weakness going on for your patella here.
Oh,
Right?
it's more.
Notice that, right? There's so much laxity,
Oh yeah.
right?
Oh yeah.
So
It
you-
means
like that.
what?
Right? You can mobilize it in any direction,
Okay.
right? If it's stiff on, like, let's say on one side, there might be an issue going on either here or here, right? I can go at a diagonal angle. I can go lateral. I can go, okay, yeah, she's got. So this is a test. Did you guys do clinical assessment
Yes,
one?
we have
Right?
done that. Yeah.
So
Patellar top test.
the patellar grind test, right?
Also
I just-
grind test.
I just went that way and she's already right? Where I didn't even ask her to contract. I just went that way and she's already like ow, right? So there's issues going on. It might be her quad muscles. It might have her TFL, right? There might be imbalance. Maybe the anterior tibialis and peroneals are the ones affecting it, right? Because sometimes they're like, oh, knee issues, quads,
But there's no-
right? Knee pain, quads.
But there's TFLN.
But you've got TFL, you've got the lower limb muscles. How about the posterior side? Because there's issues where these are compensated. Like the quads are working so hard because these are very weak or they're very tight. But we don't think about that. You don't, I mean, it's lack of education and you're still in school too, but at the same time, the teachers, it's what they know also, right? What's their continuing education and stuff. Where this is in pain, are the glutes firing properly, where this is doing most of the work. And every time you go up and down the stairs,
Yeah.
when you go down in bed, right? When you do that squat, right? I don't know if you guys seen that IG post of that Beyonce squat, like where they're like squat. I don't know. It's just this weird thing that's been happening, right? And then our anterior tibialis are quite tender, like quite hypertonic, right? Where there might be issues going on here because muscles they cross here, right?
Yeah.
So muscles are going and attaching here. So why is it that we work here all the time, but we don't treat the lower limbs? It's always upper limb,
Yeah.
right? And then we also have your hip flexors, rec fem, and then your iliacus here, right? But working iliacus, make sure you have consent, right? Because sometimes they're like, oh no, you're going too close to the private part, right? I feel like you're going in my organs, right? Because it's like right here, right? And then if you know your attachment size, like AIIS, she's like, ah, right? AIIS, right? Do you know how to go there so that you can treat there doing GTO, cross fiber friction, to help structures where you're, instead of just, or what I see people doing is just effleurage, 1, 2, 3, 4, done. Because they have like 2 minutes left at the very end, right? Just to have that full body, right? And please don't ever work on the foot first.
It's so nice that
Oh,
mobilization.
no,
Oh, it's
it's a people, it's supposed to be, it's a right.
You're supposed to work other parts of the body first before going to the feet. But
Yes,
there's people
That's the
work on
last
the feet
one.
first, and then they go up.
touch every,
And there's instructors that teach you work on the feet first,
no.
and then you go up,
Sir.
Back first.
No, we
It's
start
disgusting.
from here. It is disgusting.
right? What if I just came from the gym? I'm so sweaty. Like,
Ooh.
smell, right?
That's true.
Even
Right?
if I go to the massage, I don't want people to start.
Yeah, because
from
here,
my
rub
face.
all over your
Yeah.
back, right?
And
When
here's
did the other people start
in
there?
your face.
Instructors teaching them that for some weird reason, or maybe it's something that they started doing in their practice, like down the
But
road.
they don't realize that.
Right. So,
That's
if you guys don't know how to stretch the quad, I mean the
Okay,
yeah,
glutes,
yeah,
I mean, right?
Ito na yung masakit eh.
Yeah, and that's the painful.
Right. So either figure 4,
Figure four.
right? So you can do figure 4, right? There's different ways of doing this, right? So this I can hold both, right? So I can carry both limbs, or I can have one limb down and do this, right? So glutes, whatever, glute max, mid, min, add some rotation there, right? We're targeting piriformis, we're targeting deep external rotators, right? And she's like, ow, that's so painful, right? We can add movements like this, right? It just depends on how you want to stretch or move. Right? See how, for me, it's very comfortable to do all these movements because I know what to do, right?
Oh, joke.
Do you guys know, where you guys taught piriformis release?
Release.
Face down?
Face down.
Just like a-
Ikaw gusto mo po
Again?
I'll show you guys this and then we can end for today.
Parang na rin akong ano eh.
Again.
Nagpunta ng
I know, I'm jealous. At the back.
Of what? Alright, so external rotators of the hip, right? Permission to work on your glutes? Yes? Yeah? So I tell my students who are male clients all the time, have informed consent,
Always, yeah.
always. Even female clients, but most of the time, like 99.9% is the guys who get in trouble, right? Because there's people who are very touchy without even realizing, right? They're like, nah, nah, nah,
For them,
dun,
it's
dun, dun,
normal,
dun,
yeah.
dun, and I'm like, the client's like, why are you touching my butt? Like,
That's where those
it's creepy, like, why are you touching my butt? And then they've done that to like 5-10 people, everyone complains, and it's like, I didn't do anything wrong, right? It's because you're so touchy, right?
especially for male.
Yeah,
When
or like,
They're so
your draping is horrible.
yeah.
You're like, you're gonna lift to stretch the quads and like, I see everything there,
Yeah.
right? My goodness. So, piriformis. Attachment site of piriformis. Do you guys remember?
Attachment.
No.
Sacrum and greater trochanter. Okay? So, basically it goes at an angle this way. Right? So, let's say her greater trochanter is right there. Right? So, bring skeleton over here. Right? So you have your whole ilium here, right? So that's the ilium, whatever. It's basically kind of like this here, right? There's a video of Faye showing how to palpate and find this. I find it very uncomfortable because she's here grabbing like the butt. If it was a guy doing this, that's gonna look so wrong. Right? She's like right here. She's like playing around with the butt. Right. Basically here, right? So in a way, right? Your so for me it's